So with the examinations, I would say you need to obviously make sure you're prepared for the OSCE. So go through your examinations, make sure you've gone through each and every process of it numerous times. Just practice with your friends, find a group, just get together and practice the day beforehand, or even a few days beforehand. In terms of specific advice though, I would say that you need to remember that some of the patients are actors, so they won't be necessarily walking around normally as they would if they had the condition. So make sure that you are still going through the entire examination process with them. Even if you've seen them out and about when you're coming into the OSCEs, you need to be aware that in the station themselves, they will be acting. So you go through every single thing with them. Don't miss out anything just because you assume they can do it. I think the principle of Occam's razor is quite important. In terms of, cardiac stations, most of the patients will be long-term patients. So normal things that come up are, heart failure. That's quite chronic and long-term. So there are things that will come up on you, COPD, those chronic conditions. That patients don't necessarily present with the acute illnesses that you would see, like for example, tension pneumothorax. You probably wouldn't put that in your OSCE, so there's no point in preparing for that really in your OSCE stations. There could be a pneumothorax though, but just not a tension pneumothorax. But yeah, so it will be the common and chronic conditions that usually they come up with. But yeah, just make sure you know things, you know what you're doing, and you know the process of the examination. Before you get to the OSCE, you need to make sure that you know your conditions. So the common conditions that come up, for example, if for a respiratory exam, respiratory history, pulmonary embolisms, pneumothoraxes, COPD, asthma, those common things. It's not necessarily the rarer conditions that tend to come up. It's most likely the common conditions. And before you even enter the station, there will be a prompt. So for me personally, I read the prompt and I come up with my differentials, what I'm looking for when I get into that station. Once I'm there, then I'm just trying to find, obviously you start with the open questions, but then you're trying to build a story and build a case for your condition that you have a clue is, or the number of conditions that you have clues that it is. And before you even get to the OSCE, obviously you need to make sure that you know your conditions and are prepped. In terms of the care of the surgical patient when you go upstairs, I would say that you need to think about what you're looking for when you get to surgery. So at the end of the day, you're a medical student. You're not going to be expected to know what a specialty registrar would be or a consultant would be able to do. You're meant to be able to know what an F1 would be able to do. So what do the F1s that you see on the wards do? Most of them deal with the perioperative care. So when you're thinking about that, you need to think about your bloods, what bloods you're doing for each specific patient, what you're doing before the patient gets into surgery, your consent forms, all those important things that need to be done before and after surgery. Those are the things that I mainly focused on in terms of my revision for my surgical stations. Not necessarily what surgery is happening, because you're not necessarily expected to know the ins and outs of each surgery that you do. But most of the perioperative care will come down to the juniors, and that's what was important in terms of what I thought. When it came to GP and patient-centered care, I think being a really good listener is very important. Try to empathize with the patient and think about what you would do in that situation and put yourself in their footsteps. Don't say anything too inflammatory. That's probably not going to bode too well for you, both in your building of a relationship with the patient as well as your OSCE scores as well. So saying things like "I understand" may not necessarily understand. So it's something I try to avoid saying "I understand," but just trying to be a good listener and trying to suggest ideas that are sensible in those scenarios will bode you well for that station. Now this is where I use, there's resources online. OSCE Stop have resources on drug medications, their common side effects, and common contraindications of the drugs. So being aware of the side effects of drugs, very important, especially for stations centered around medications. I feel like that's probably one of the most important things. And OSCE Stop have common drugs, so the common drugs are where you want to focus on, not necessarily the rarer drugs. Yes, had a lot of funny moments in my third year OSCE. I made up a sign, so that's why I'm saying don't make up signs. So I thought I could hear a breathing, but it was just a heart. So make sure you know what a heartbeat sounds like. It's probably a really good thing to know. What else? I had a station that came up that I was not expecting, so I feel like don't try and second guess them. Don't try and think that you're going to go easy on me just because I'm the first day. Doesn't happen, and you then get stuck in an ILS station where you have no idea what you're doing. That's not good.
So I think with examinations, it's really important that even though you should practice the routine with your friends, you should also make sure you practice on real patients, because I think everyone gets a bit scared that they're going to hurt the patient. So especially with like orthopedic exams, you should get used to kind of moving the patient around in a way that's comfortable for them, but also so that you're doing an adequate examination. It's also important in terms of picking up actual signs, because you will be expected in third year OSCEs onwards to pick these up on examination and report them back. Presentation of the examination is also quite important, because in second year OSCEs you're used to seeing normal patients, but you should be able to summarise which ones are important to report back and will contribute to the diagnosis, and also which findings are normal and which are important to report as normal. A way to do this might be bedside teaching. Make sure you chase up people who are planning on doing bedside teaching. I know it might be difficult with COVID to get that organised, but I think you have to be really proactive about it, because it is very important in the long term by the time you get to your OSCE at the end of the year. And also, if you're just practicing with your peers, you can get your peers to watch and assess you, because they'll know what's right to do and they'll be able to give you good feedback. For when I did my clinical skills and problem solving OSCE station, I had an ECG. This is important with, you'll have practiced the skill, I'm sure, on patients on the ward, and also you can go to the clinical skills unit and practice there. But it's important to practice presenting this in a good, clear way where you're showing all the findings that you have, and not jumping to a diagnosis, because you have to show everything that you've seen, which is important. I'd say it's good to have a step-by-step process to go through so that you don't get flustered when you're in the examination and presenting at the end. And I think you should make sure you see as many patient drug charts as you can, because they can be quite confusing to look at, and there's all the different sections. And I'd say if you can, you could ask on the ward whether you can take some back with you and practice writing them on them, because you can't actually practice on the real drug charts, but you will be expected to write in one in the exam. So maybe practice at home and get your friends to check it, because they will scrutinise you on very small details that you need to make sure you don't make mistakes on. And also looking in the BNF for any random drug, because you'll be able to, you should make sure you're fast at doing that for when you do it in the exam, because that you don't want to waste time on that, basically. For GP-centred care, I think it's really important that you think of the patient's feelings and make sure you're not forcing your own agenda, because you will be given a kind of spiel that you're meant to be thinking what sort of treatment and management plan you're working with them for, but remember that you're working with them, so don't force what you want onto them. And if they have capacity, they can make whichever decision they want. It might seem incorrect to you, but you don't know what's correct for them exactly. For this one, I think it's important that you take a short patient history, just so that you have a bit of an idea of what sort of patient factors you have to consider when you're giving the advice. So suppose you had a patient with diabetes and they tell you that they're drinking some crazy amount of alcohol each week. It might be something you have to focus on when you're telling them to cut down on their sugar, and you wouldn't know that without taking a patient history. And making sure you don't forget about the social factors, because often they're really important, and just as important in making sure the medication and the management plan works. And description of the mechanism of action in layman's terms can be quite difficult, because we learn it in quite a technical way. So maybe you could practice with maybe non-medic friends of yours, or any parents or family members, or you could even practice with patients on the wards, because I think they'd appreciate understanding what's going on with the medication sometimes if you have time.
So when we do history taking, don't forget to ask for the patient's name and age, because when you report back to the consultant, you have to tell who the patient's name and age is, otherwise the doctor doesn't know who the patient is, and they might lose concentration as well. Also, at the beginning of the station, before you start the station, there are prompts outside, so when you read it, obviously they will tell you the presenting complaint. So try and think of some differentials before you go in, so that when you do go in, you can ask some questions according to the differential, because at the end of the exam, the examiner would ask you, why did you come up with these differentials, and justify why they might not be the actual condition they're presenting with. Also, usually when I go before into an OSCE station for history taking, I write down SQUITAs, past medical history, family history, drugs, allergies, all of that, so that it prompts me in case I do forget. Because sometimes when you do go into an OSCE station, you sometimes have a mind blank. So at least when you have something written down, you can like quickly look. You don't have to note down everything, but it's just to prompt you in case you do go blank. It's important to not interrupt the patient when they're speaking, but sometimes patients can go off on a tangent. So try and bring them back to the point that you want to get across, and try and get the answer that you want. Also, look at the mark scheme that the university gives you. I use that for all my OSCE station, the history taking, examination. Look at the mark scheme, because for every point you ask, so if you ask about drug allergies, you get 1 mark. If you ask about past medical history, you get 1 mark. Make sure you know the mark scheme inside out. And then remember to ice your patient. Everyone forgets to ice the patient, so remember to ice the patient. So when you go in, I don't know why, but some people forget to wash their hands, which I think is quite disgusting, but please do remember to wash your hands, because you do lose marks on that. And it's a simple thing to do, because I think it's like 2 marks. It's a simple thing to lose marks on. Practice consistently. So practice with your housemates. I know because of COVID, you can't really practice on patients, but practice with your housemates all the time. I know people say, oh, you can practice OSCE, examination 2 weeks before the exam. When you go and do your examination in front of an examiner, they will know that you've only practiced for 2 weeks, because people who practice consistently throughout the year, they will be slick. They will know what they're doing. They will do it without thinking. When you sometimes might think, oh, the examiner can't see that I'm thinking what I'm going to do next, but they can see. They've examined for a very long time. They know who's done it for a year and who's done it for 2 weeks. And when you are doing it, after you finish practicing, make sure you present your findings as well. Practice that, because that's an important aspect of the examination as well. Many people forget to do that, and they might do the examination in a slick manner, but then they forget to, they might find it hard to actually interpret their findings and present it. Use geeky medics. Again, use the mark scheme that the university gives you, because again, they tell you what you get your marks for and what you lose your marks for. There are YouTube videos made by University of Leicester on YouTube, so make sure you do use them. My university's given it for a reason, and they've told you what you need to do, and if you've done that and you follow it, you would be fine, you'd be okay. There are also new clinical skills video on Blackboard under themes. Use that again. Watch those videos, because they literally tell you what you need to do to get the full marks. So practice ECG. So if you write in Google practice ECG question, there are so many sites. Practice them. There's a site for interpreting ABGs called Oxford Medical Education, which I use, but there are many other sites. Again, practice them throughout the year. Go, I know because of COVID you can't really go, but if you do get a chance to go to wards and stuff, practice it with your F1, especially in renal wards and respiratory wards. You can practice reading X-rays and ECGs as well as ABGs. Download the BNF app on your phone. I know you need to practice actual physical, practice it with your friends. Do patient history question, and then practice, find this medication. Practice prescribing, especially in GP practice. It's quite good to environment to practice it. So if I was you in your GP placement, I would try and practice as much as I can. So if someone cries in the OSCE station, your patient cries, don't start panicking. Give them some tissues and try and learn how to comfort them. Just don't stare at them oh my God, they're crying, I've made them cry. No, that's all part of the act. Again, don't forget to ice them, which is really important, especially in GP centre case. All about how are you doing the holistic way, trying to look after the patient and trying to understand the concerns and how you're trying to comfort them. Also in GP, don't always just think about, I need to give them a medication. If they come with a problem, try and think of ways they can, use non-medical therapies before actually using medicines. Again, this is the same advice I would give for info giving as well.
So the tips that I'd give for OSCE stations, starting with histories, is really to practice on sort of doing 1 minute mind maps, because when you go into a station, it's going to be a scenario that's given. So chest pain being a very obvious classic one. It's not going to be that you're told what condition they've got. So you really need to think about, in that minute before you go into the station, get good at writing mind maps thinking of all the different systems that could be. So with chest pain, that could be respiratory, cardiac, musculoskeletal, GI, and then focus the history on narrowing down those differentials and thinking about differentiating questions. So, if the chest pain's sudden, think, is there a swollen leg at the same time as the recent travel? And, base the history and make it flow off those answers and lead you down a particular route. It's also key throughout the station to pick up on any cues from the patient. If there's something that they are suggesting that they find particularly distressing, then acknowledge that and explore that. So try not to let ice be this really artificial thing that you just leave to the end. If you can fit it in within the station, then that really shows the sort of empathy that they're wanting to see from you in a station. So when it comes to clinical skills, the absolutely obvious thing is to practice these as much as possible, and also, if you can, to practice with Leicester's equipment, because it does vary a bit in some of the district general hospitals. But one of the things that you can do without being in the clinical skills lab is to really habitualise the sort of consenting process and the aftercare advice that you give, or the order of draw when it comes to blood bottles. And if you've got that really solidly down in your head and you've practiced it lots of times over, then that just frees up memory space for actually focusing on the main clinical skill, and it gives you a lot of marks sort of guaranteed before you even go into the station. So for management and prescribing station in medicine, and also the surgical management station, you need to think about trying to come across confidently, because the problem with these stations is there's not a natural pace to them. You have to sort of set the pace as you go along, so don't rush, try and be confident, be logical, and get used to practicing ECGs, ABGs, chest x-rays, just so that when those things come up, because one of them is very likely to, at least, it at least seems like on those sort of really key things that you're very confident on them. Another thing with these sort of management stations is to try and at least have it in your head a good idea of sort of range of bedside tests that you can order, because a lot of this is thinking about things from a wide range of perspectives. So if you just think about investigating something just through blood tests, for example, then you're obviously going to be missing out on something else. So if it's an infection, think about, if it's a surgical patient, do we need to swab the wound? If the patient's got diarrhea, then a stool culture, for example. Respiratory, thinking about, again, sputum culture. So really practicing those bedside tests and investigations. So for the a GP patient-centred care station, a sort of general system that you can use is to think about, first of all, not rushing in, giving out lots of information, but slow down and sort of assess what the patient already thinks or knows, or what their health beliefs are, because you'll often pick up on some things which are either incorrect or slightly off, or you'd make the whole thing much easier in terms of guiding their healthcare if they actually were properly informed about things. So assess what they know, and then sort of challenge any health beliefs that are incorrect, and then move on to reassessing with the patient, what do you think about this now? And then the last station to talk about is the GP information giving station. So as I said with some of the other stations before, it's important to have quite a rounded approach with this. So really think about the common conditions before you go in that you might see in general practice, diabetes being an obvious one, and think about what are the different ways of managing that and how to get that across to the patient. So you need to think, say in that case, about diet, about exercise, about a range of things, rather than the one that we're prone to maybe jumping to, which is obviously medication. But you do need to get to medication, and when you get to that, it's useful to have already in your mind an idea of the sort of contraindications, side effects, because that's what the patient's going to ask you, and maybe just a little bit on the actual daily practicalities of taking that medication. So how often do you take it, around meals? If there's any particular information that's really useful, for a patient to know, because they're the sort of practicalities they want to know often. They're not as interested as we are in how the medication works, but what it's going to be like to live with, what side effects they might expect. And a general theme with the GP stations is really being holistic and being a good listener, but also guiding the conversation, because you've only got that 10-minute station. So a tip with doing that is to bounce off things that the patient's already said in the consultation, which makes them feel like they're being listened to, and gives them confidence that you're paying attention to what they're saying. But it also allows you to jump in and guide or steer the direction of the consultation.
Hi, my name's Ayushi, and I'm just going to give you some general tips to relax your nerves before the OSCE and during the OSCE. So tips you should know is that before the OSCE, make sure you get a good night's sleep. Make sure you've had enough sleep so you can relax your mind and that you can retain that information. In the morning, make sure you had breakfast and you've had some water, and bring a water bottle to your OSCE exam. Before you enter the OSCE room, some people prefer to have notes and they relax by reading through those notes, so find out what works for you, and others can prefer just sitting by themselves and just focusing on what's going to happen next. During the OSCE, make sure that you read the prompts slowly and carefully. And even if the station goes wrong, the previous station or the station you're on, just try to forget that station and move on to the next one. Because even if you messed up the one before, it won't affect your grade significantly to make you fail, and you can still pass. During the OSCE, if you're feeling nervous, just take a deep breath. It's all right to have a little bit of a pause. Think about the questions you're going to ask, but most importantly, try to be in the moment and listen to what the patient's saying. And as you can see, all of us as individuals, some of us struggle, some of us are quite confident, but we're all independent individuals and we can all get through it. You just have to put a lot of trust in yourself and bring out that confidence when you're in that station, because you have that one moment to shine.